Pneumonia is an infection that causes inflammation in the lungs, especially the air sacs or the alveoli, the generation of airways. It may be filled with fluid or pus. So basically, the presence has in mainly cough, fever, chills, and difficulty in breathing. So there are various classification. One of them is to define it is as community acquired pneumonia, healthcare associated pneumonia, or then the other classification is to divide up according to the organism. Pneumonia is a contagious depending upon the cause. Usually the bacterial and virals usually spread from person to person through the coughing, sneezing, or touching the contaminated surfaces which are affected by bacteria or virus. The fungal pneumonias are usually common in the immunocompromised patients or who are already having many comorbidities or medical conditions. In the bacterial, the most common is Streptococcus pneumonia, Haemophilus influenzae in our setup. In viruses, as you might be hearing about flu virus H1N1, which is more common during the flu season than the respiratory syncytial virus, the coronavirus, which we are all are aware of, COVID pandemic. Fungal infections are very common in a normal, healthy individual. So still example are histoplasmosis or aspergillosis infection. The patient usually complains of cough with sputum. The sputum may be white, green, yellow, and sometimes it may be red color also in some conditions. Then fever may be associated with chills, high-grade fevers, then difficulty in breathing or shortness of breath, then chest pain while coughing. Then he may also have fatigue, excessive sweating. And in the elderly population, usually we see with confusion. Young children and older adults, that is age more than 65. These are the main age group which we need to protect and look after the signs of pneumonia. Okay, the early newborns also might are at risk sometimes. So, and the patient who are already have very weak immune system, just like I said, immunocompromised patients, those are suffering from HIV, cancer patients who are on long-term steroids, those with chronic health conditions like the respiratory conditions, like asthma, COPD, heart diseases, congenital heart diseases, and who are bedridden cases or who have difficulty in swallowing or they have poor reflexes. The main is the symptoms, just like I said, cough, fever, chills, difficulty in breathing, and any other symptoms like chest pain, confusion. So these are the first how the patient presents. Then on examination, we can hear abnormal sounds like crepitations or crackles when auscultating the patient. Then we do thorough examination. How is the breathing rate? How are the oxygen saturations and measure the temperatures also. Then the first test we usually send are the chest X-ray. Chest X-ray gives a fair amount of idea how the pneumonia is there, and we can diagnose it. Then we do send some blood tests. In blood tests, we can get to know the white blood cell counts, which gives the amount of infection. Then there are few markers, CRP testing, ESR, and this test give us the amount of infection or inflammation ongoing in the body. Then we, for the diagnostic purposes, then we can do the sputum test, sputum for bacterial culture, AFB, that is TB, to rule out tuberculosis. From there, we can understand what type of bug the patient has, and the bug is seen on the growth, and accordingly we can change the antibiotics. Then if still it's inconclusive, then we can go and do a CT scan or do a bronchoscopy, that is BAL, bronchoalveolar lavage, from the affected segment and send that sample for further microbiological testing Just like how we send it for sputum culture, we send a ball culture, and we can find out the organism and diagnose. Usually, if it's a bacterial infection, we start off with antibiotics. Okay, so antibiotics, according to the guidelines, we start them off according. Then, if any growth is seen in culture and it's sensitive to some specific antibiotic, then we can switch over to that particular antibiotic. If we are suspecting a viral pneumonia, then we have antivirals. We can give supportive care, maintain the hydrations. Or of course, fungal pneumonias, then there are antifungals and further treatment. So recovery time, if normally the patient recovers in couple of days or within a week, if he's put on a proper antibiotic and if the patient responding to the treatment. The cases which are not responding or which are requiring oxygen support at the time of admission or intensive care unit support, so they take a week or a bit more. So the first thing we look after is how the patient symptoms are, whether his fever has reduced or not, that the cough has reduced or not, because some symptoms take time to recover. Even if we do repeated X-rays and CT scan, still it takes time radiologically to get back to the normal state. Usually the radiological resolution takes 6 to 8 weeks. But the more important is how the patient symptoms are and how the patient is. If the pneumonia is untreated and left alone, then there is chance of formation of lung abscess, or there is chance of formation of pleural effusion. It may complicate it into then empyme also. Then this infection, which is localized, then it can spread over to the blood through bloodstream, and we call this condition as sepsis. And it may involve the other organs also. If the patient is properly treated, it's very less likely that the lung capacity may reduce after having pneumonia. Initially, the patient may experience fatigue and couldn't perform to at his best. Then, but after proper treatment, yeah, there is no such hazard. The best way to prevention is having a healthy lifestyle, have a balanced diet, exercise, stay hydrated, avoid smoking. The other aspect, maintaining good hygiene, always wash your hands before or after food. Avoid close contact with the patients who are already suffering from pneumonia or any viral infections. Then the other aspect is to get vaccines. So vaccinations in elderly population or patients suffering from chronic disease like asthma, COPD, heart diseases. So these patients must get vaccinated for pneumococcal vaccines and yearly flu vaccines, so that they are protected from the severe form of disease.